excited to give a little presentation on the latest and greatest in regenerative medicine. Excited to have a lot of questions answered for you guys in terms of how to stay healthy, how to improve your health span and your lifespan. And most importantly, I'm happy to introduce Erika Shepard, our new nurse practitioner.
Woo!
Been with us for several months now, doing an awesome job. She has 9 years of experience in functional medicine as a nurse practitioner, has a lot of interest in mind-body medicine, so she's really kind of up to our ability to help people with managing depression, anxiety, other mental health issues, while at the same time addressing the functional root cause of illness. And I'm going to allow her to give the first presentation, of course, and then I'll give the second one on this one that I have queued up on the TV screen. So take it away. Yeah.
Thank you guys so much for the warm introduction. I know I've met a lot of you, and some of you I'm still getting to know, so thank you so much for being here. It means a lot to us. First of all, who in here knows what functional medicine is? All right, who here wants to learn more about functional medicine? Yes, okay, fabulous. So I want to talk about functional medicine from the perspective of being a provider and what it is, but also from my own personal health journey and experience, which maybe some of you can relate to. I'm actually healthier at 39 right now than I was at 9 years old, and that is all thanks to functional medicine. So first of all, functional medicine is really what it sounds like. It's all about addressing the dysfunction in the body. It's with the premise that the body is meant to work, and if it's not working, there's something that is getting in the way of it working. Now, when I was trained in conventional medicine, it was this whole notion that there's some defect in the body, and we just need to accept that. And after I started practicing as a nurse for many years and started seeing how people weren't getting better when we would treat them with just solely medication or solely through that lens, I was just like, something's really missing here. And then also for myself, I grew up a very sick kid. So I grew up in Ohio. Anybody here from Ohio? That's fine. You're fine. Congratulations. So, I grew up in Ohio, and I was sick all the time. When I was in 4th grade, they thought I had lupus. I was breaking out these whole body rashes. I was already losing hair. I had a lot of gut issues, and I'm like not even in 4th grade. And then once I became a teenager, I started developing more digestive issues, a lot of hormonal issues, and it's just like, oh, she's just a teenager. Oh, she's just, this or that. But your labs are fine. She's healthy, otherwise, like all of her, markers are fine, so therefore she's fine. Well, I kind of got tired of this once I got into my 20s and I started going to college. And I'm like, you know what? There's got to be a better way. And so I went to my first, it was a naturopathic doctor in Phoenix. I went to undergrad at Arizona State, and I just was like 23, and I'm like, I guess I'll go see this naturopathic doctor. But it's the first time somebody ever asked me, what do I eat? How do I sleep? How do you feel? And I'm like, this person is actually like asking about me, right? And not just checking off symptoms and not just, treating my labs, which were always normal, right? But yet I was always so unhealthy. So I started addressing nutrition. And then in my 20s, I discovered a paleo type diet, which turned my health around completely. Like my autoimmune stuff went into full remission. And I thought I had figured it out. I was working in nursing. I was really passionate about explaining nutrition to people. And I thought, this is the answer to everything. And then in my late 20s, I was in grad school at Georgetown, and all my autoimmune stuff came back with a vengeance. And I'm like, oh my gosh, there is a missing piece to this puzzle that I haven't figured out yet. And so I was really blessed that in my last semester, that I met a nurse practitioner who was like, those patients who there's nothing's wrong but something's wrong, and I was like, yes, I'm her, that is me. And so she was like, well, there's this thing called mind-body medicine, and here I was in my late 20s at the time, and no one had ever mentioned this mind-body connection and how our spiritual and emotional health can affect our physical health. And so that opened up a Pandora's box for me, especially with my background. I worked psych as a nurse, and mental health I always had a big passion for. And I was like, you know what? My mental health patients were always the sickest physically, too. and I realized, there's a big component here as well. So when I started addressing my own mind-body connection, and that component, my autoimmune symptoms started going to remission. And really, I've been in remission since. So I discovered functional medicine, this whole notion that the body is meant to work. And so when I graduated nurse practitioner school, I really, went down that route of more functional medicine, and particularly adding the mind-body medicine piece to create that holistic health and wellness. And now for my patients, I want to bring that same approach so people don't have to go through what I've been through. And I truly believe that we can get healthier as we age, and that's the longevity piece. Like I said, I'm healthier now at 39 than I was at 9, and that is all thanks to functional medicine. It's getting rid of what was getting in the way. So what were those blocks, right? For me, it was hugely gut health. If any of you have been in my program, you know that I love to test the gut. And so if you come through, a lot of people are like, but I don't have gut issues. I'm like, that's okay. That's not the point. There's usually a lot of imbalance in the gut that contributes to these issues. So what happened to me was that by my mid-30s, I had no gut issues, but I was really still struggling with fatigue. And finally, I was just like, you know what? I'm gonna get my gut tested. I can't kick this fatigue. And even though I had the most amazing gut health regimen, I ate so healthy, I've been taking my probiotics, right? Do all the things we're supposed to do, right? Because of my childhood antibiotic use, my gut was so toxic that it came back as like a D- report. And I was like, well, there it is. And that was the root cause of my fatigue, but I had no gut issues, right? And as I'm, seeing patients over the years, as I test their guts, they might have thyroid imbalance or not being able to lose weight or having anxiety and depression. We test their gut and it's like, look what's going on here. You actually have a parasite. You actually have yeast overgrowth. This is why you're having sugar cravings, because you have all this yeast in your gut, and that's causing you to have this craving. So it's really important to address the basics. I really like to get back to the basics. So it's the mind-body connection, what is going on spiritually, emotionally, that is affecting your physical health. Looking at your gut, looking at how you're detoxing. Right now I'm going through a really nice detox. And Letitia and Quicksilver, our amazing friends over here, have been helping me with that. We actually have a raffle tonight with our Quicksilver Push Catch. So that's, please sign up for the raffle, don't forget to do that. But yeah, that whole piece of if you're not detoxing properly, you're going to be building up junk in your system, and that's not going to feel good. It's going to cause all kinds of issues. So you want to be detoxing properly, and you want to be also paying attention to everything you're doing in your day-to-day life. Your relationships matter. When people come into my appointments, I'm like, so how are things with your partner or your best friend? You're like, girl, I just met you, okay? And I'm like, but it matters. That's why we're talking about it. So all that to be said is functional medicine is here to say that your body is not broken. So any of you in here who are dealing with any health issues, I'm here to say healing is possible. Your body's not broken, and everybody's different too. So we want to do deep work to get to the root cause of what's going on for you. It's not one size fits all, and that's the other beautiful thing about functional medicine is that we can tailor treatment to you. So I want to give a great thanks and welcome to Dr. Grover, because he has built this amazing practice over the last 30 years, and I'm really privileged to be part of it and the amazing work he's already done. And so I just want to say hello and welcome to Fred as he talks more about functional medicine tonight.
Yeah, so a lot of what she's talking about is treating the fire rather than the smoke. And it's the analogy of opening the window to let out the smoke rather than actually going down and treating the fire. So if you have dysbiosis, inflammation in your gut, and overgrowth of bad bacteria, you can identify it, you can treat it, and then we can rebalance it by repopulating it with things like probiotics, prebiotics, etc. And your gut inflammation goes down, your serotonin levels normalize, your cortisol levels normalize, your whole body is just a happier being in general. Some of the things I wanted to talk about today are mainly just how to thrive in this crazy effing world, right? I think all of us are, realizing that things aren't the same as they used to be, particularly this year, and the stressors that we're encountering, whether it's work-related stress, personal stress, witnessing what's happening with all the wars around the world, etc., are impacting us. And how can we keep our heads up mentally how can we physically stay strong within the setting of this crazy, stressful world. So that's kind of where I thought I would go with on this talk. A little bit kind of a Debbie Downer initially, but then I talk about, you know what, here's what we recognize and here's what we're going to do to stay strong. And I think we just have to go there to identify the threats and then move on. So here we go. I don't know if you'll be able to see this real well, but what I'll do is I'll just try to read it as well as I can too. First of all, our team, you met Erika. We've got Austin, who's been with me forever. Give me Austin. She came in and has been helping the team quite a bit, doing a lot of our marketing. There's this crazy dude, and then Julie is our amazing nurse. She does all the, where's Julie? Stand up. Julie does all our IV, peptide therapy, a lot of weight loss counseling. Of course, everybody knows about GLP-1s, Ozempic, and Wegovy, Mounjaro. We've been doing it for a long time. Seems like everybody's doing it now, dentists, etc. But honestly, they don't have the expertise to be looking at the nuances of how it could be adversely interacting with drugs, etc. So if you want the real expertise, go to Julie. She can help you out there. And then we've also had a really strong program helping people out in immune function in terms of post-COVID syndrome, improving mitochondrial function to reduce the risk of long COVID. And Julie was instrumental in that when we had that horrible pandemic a few years ago. Now, hopefully we won't see another one, but we're prepared to keep everybody healthy and strong should you get hit with it now or with a more severe strain in the future. And then Brianna, where's Brianna? Over there. Brianna's our office manager. And she's been on board with us just for a little while. I mean, how many months? A few months, right?
About 3
months, yeah. And just organizing things because we were, before I bought my practice, we've had a lot of changes in terms of electronic medical records, phone systems, all that kind of stuff. So my apologies to you guys for the challenges of the phones and the EMR, but I think we're finally getting our head above water and things are good. But please give us feedback to change and improve things along the way. So I think our most important thing we have to do is be intelligent beings, be aware of what's happening around us, right? And I have a lot of friends that don't watch the news. It's probably a good thing they don't because it can be stressful, but in a sense you also want to be at least somewhat aware of what's happening around you, right? So it's best to be able to recognize these threats rather than bury our heads in the sand, living blindly and unprepared, right? We want to strategize a proactive plan so that we can stay healthy and live with confidence and without fear. If we don't know what the threats are, we're not going to be prepared. We can get ourselves in trouble, right? I'm an old Eagle Scout. My motto is be prepared. You always hear me talking about being prepared, right? So what are the stresses? And this is just a very broad stroke of stresses that we're dealing with right now. I mentioned a few of them, the local and global conflict, whether we're talking Ukraine war, whether we're talking Gaza, whether we're talking Portland being invaded by the National Guard, job-related stress, family stress, our kids, divorces, all those kind of crazy things, cost of living increases from inflation, less predictable financial markets, healthcare costs, which are probably going to go up with the new budget if it ever passes, tariffs, how are those going to impact us? A big one, of course, is the threat of AI. What is it going to do? Physicians ourselves may lose our jobs and we have a robot that's doing your prostate exam. Imagine that. And then we may see our kids really being threatened in terms of not having jobs. So we spend all this money putting them through college and graduate school, and then they end up, being a Walmart greeter or something. So it's not a great market in terms of what AI may pose in terms of threats to job stability across the board. And then I think just the craziness of social media, the news, cell phone distractions. Every time our phone beeps is creating a little bit of a cortisol surge, right? And then every time we look at Facebook, we get a little dopamine surge because we're like, oh, cool, they like my post or whatever. So it kind of takes us on a roller coaster of stress and then a little reward from dopamine. And all that can adversely impact us, I think, in the mental health realm. And we've obviously seen that, particularly in our teenagers and our youth that have unfortunately see a lot of suicide related to online bullying and whatnot. And then of course we have the age-related decline, right? I've lost a lot of my hair, that's kind of a bummer. We've had increases in disease as we get older, risks of cancer rise, that's why we start screening for colon cancer, skin cancer, and breast cancer, and all these things, which are excellent recommendations, and I definitely want you guys to stay on top of those. But just recognizing that as we get older, we need to stay on top of those screening protocols. We have new viruses that are coming out. They're even saying that with AI, people that are, biology majors, microbiology majors, could basically make a superbug in their garage, and that's pretty scary what could happen. Now, hopefully that won't happen, right? We have the environmental and food toxins. Environmental mainly being, the toxins in the air, which can blow over even from China. Of course, LA produces a lot. We have toxins coming out of the mines here. They go into Chatfield Reservoir. We need to be mindful of our water supplies. So that can all impact us and create inflammation in our gut, inflammation systemically in our body as well. We have physical stress related to climate change, and a lot of people don't appreciate that, but it's significant, particularly when we talk about the droughts that are happening, the impact on the food chain, but also in terms of ozone levels rising, and other impacts just on the global shifts in heat and cold and whatnot. And then we have, God bless America, rising rates of gun violence and, mass shooting that occurs, every 3 days or maybe every day. Kind of lost track. So quite a few threats that are out there that we have to be aware of and be conscious to keep ourselves thriving in this somewhat nutty world. So to me, the key functional medicine strategies to address these challenges includes doing our best to maintain a healthy, balanced diet, regular exercise, of course, mindful-based activities to keep stress under control. That could be meditation, getting out for walks in nature, doing breath work, sound healing. For me, I like to encourage people to even consider psychedelic therapy with facilitators. I think that being aware of hospitals is important too. We're seeing more and more hospital-acquired infections. University hospitals just got shut down in their surgery department because they weren't sterile processing well. I mean, just scary stuff like that's happening all the time. We don't want to get a hospital-acquired methicillin-resistant staphylococcus or some other crazy superbug that is not treatable. So what's the end game? Stay the heck out of the hospital unless you absolutely have to go in there and get a procedure done, right? And then make sure that you've got a good hospital, a good surgeon, and you're doing all the right things that they advise for you so you limit the risk of any potential bad outcomes. I mentioned earlier, keep up with early cancer screening. I can't tell you how many people I've heard about that were diagnosed with stage 3 colon cancer because they weren't willing to get a colonoscopy at age 50, and at 55 they had mets to their liver and it's game over, right? Same thing can happen for other cancer screenings. If you're not doing the basic screening, you miss that opportunity. It's a tough battle to get it under control. We do have some amazing new cancer screens like the Galleri screen, which everybody from Peter Attia to Tony Robbins talk about. The Galleri is basically a blood biopsy that will look for cancer markers and pick up pancreatic cancer before even an MRI will do it. So if you're worried about that because of family history or getting older, we're one of the few clinics in town that offers the Galleri scan, which is pretty cool. And again, we want to address the root causes of physical and mental conditions whenever possible. So I just kind of put together 10 strategies, and these were just totally off the top of my head this weekend when I put this together, and I probably missed a few, and maybe some of them are a little redundant as well, but I think one of the most important things is reducing inflammation, and Eric was talking about reducing inflammation through the gut. That's one strategy. Sometimes we've got inflammation that's related to rheumatoid arthritis, sometimes it's related to autoimmune disorders, other times it's related to toxins, whether it's the bad air or the foods we're eating. Again, balancing the microbiome is a easy, low-hanging fruit to address and to test. And sometimes we don't know we have dysbiosis until we test. So it's a good idea if you guys haven't done a microbiome test, in a few years, just to do it. Super easy. Fill up a cup and send it in, right? is keep your weight in a healthy range, because we can develop prediabetes and diabetes. If we develop diabetes, it increases our risk of Alzheimer's fourfold, 400% increase, pretty huge. Not to mention the joint issues, the heart issues, everything else that comes with that. So keeping our weight in a safe range is really key. And now that we have GLP-1s to help people reverse prediabetes, reverse diabetes, there's no reason not to take advantage of those goodies. We can proactively reduce inflammation with antioxidants. So for example, with COVID, I had COVID, I've had it 3 times now, I think. But one time I did my labs and my C-reactive protein, an inflammatory marker, was 20 2 weeks after. So it just goes to show you a normal C-reactive protein is 1. So it's 20-fold increase. It is a huge fire in your body when you get COVID or the flu. And you can put out that fire by doing things like IV glutathione, Julie, or even oral glutathione, really pumping the antioxidants, the vitamin C, things like that. And it will reduce your risk for long COVID without a doubt. We also advise things like NAD, which I talk about here in a little bit. And then again, trying to identify autoimmune inflammatory conditions. Some of these can be tricky, and I may have to get a rheumatologist involved, but those can also help cool off fires and keep you healthy and prevent the damage to the rest of the body. So optimizing mitochondrial function is number 2 for sure, because the mitochondria, the cellular workhorse, is in every cell of your body, particularly in your brain, which sucks the majority of your energy, right? And if those mitochondria start taking a hit from COVID, which causes mitochondrial dysfunction, you're going to have brain fog, you're going to have things like Parkinson's, multiple sclerosis, other neurodegenerative conditions. You may even have gut issues. So people with long COVID will have gut issues because their gut isn't contracting normally. The muscular strength is off kilter. So we can address the mitochondria by infusing our patients with NAD, which is a precursor that helps within the Krebs cycle, which helps produce ATP. It's kind of a complicated cycle from biochemistry, but as we fire up the Krebs cycle, this circular pathway, we spin off more energy, and then we charge up the cells, which allows for better cellular regeneration, allows for better immune function, and then completely mitigates the post-COVID syndrome or chronic fatigue syndrome that people might even have from like EDD and other conditions as well. There's other cool ways that we power up the mitochondria. Exercise, of course, is a really good one. It will naturally build up the mitochondria, particularly in the muscles you're exercising. But CoQ10, everybody knows that one is a good mitochondrial supplement. And then methylene blue is an oldie but goodie that came kind of back into vogue probably about 3 years ago, and it's now available in these capsule forms that we have in our office, pretty reasonable price. You can do the liquid, but you'll drip it down your shirt, your teeth will turn blue, all that kind of fun stuff. But the cool thing about methylene blue is it works rather than on a pathway producing ATP. It creates an electrical differential across the cellular wall of the mitochondria. So it's almost like a battery with an anode, cathode, negative, positive charge. And when you have that electrical difference that's enhanced by methylene blue, it charges up your cells too. So again, exercise, methylene blue, NAD, CoQ10, and you're charging up your body. You'll have less brain fog, and you'll definitely feel a heck of a lot better. So that's tip number 2 there. Tip number 3 is getting rid of zombie cells. What are zombie cells? Zombie cells are the old effing cells in our body that need to get cleared the heck out of there. And as we age, we get more and more zombie cells. That's why I look so and if you do certain things, eat a healthy diet, a more vegetarian diet helps clear zombie cells because it inhibits the mTOR activity quite a bit. That's one strategy. But if you really want to rev it up, we can do something called rapamycin. Rapamycin is a prescription drug that Peter Attia talks a lot about, and other biohackers like myself talk about. And what it will do, you take it once a week, it kind of signals the body to help identify those old cells that need to get out of our body, and it tags them for the immune system that says, yeah, you're an old dude, get the heck out of here, grabs it, clears it out of your body through the liver, And in doing so, it reduces inflammation in your body. And what's really freaking wild is in dog studies, we haven't done a human study yet, but dogs are pretty damn close to us. They get like a huge, like 30 to 40% extension in their lifespan. I mean, there's nothing out there that will give you that kind of extension, you know, beyond exercise itself. But you add exercise, you add rapamycin, you can really improve your lifespan. And most importantly, your health span, which is quality of life, being able to ski, being able to mountain bike until you're 80 instead of being stuck in a lazy boy recliner at 65, right? So health span can be improved by addressing the mTOR pathway with rapamycin. Now there is another supplement that we carry called Ficitin. Ficitin comes from fruits and veggies, right? And we have a concentrated capsule by Designs for Health that has that. So for those of you that don't want to go pharmacologic and kind of expensive, Ficitin you can buy from a lot of different companies, but it's another good one that you can either do solo or combine with rapamycin. So again, you get the old cells out, the inflammation goes down, you live longer with less inflammation, and you feel better. So great strategy for number 3. Number 4, definitely consider advanced preventative screening. The old school cardiovascular screening was, oh, let's go do a treadmill and an echo, right? And most of my cardiologists are still doing that old school stuff, right? And then if it looks a little funny, they do a heart cath because they can make a lot more money doing a heart cath than they can doing a heart scan. And the people that make the money from a heart scan are the radiology suites. But there's a new artificial intelligence heart scan by Clearly, by a guy who actually lives here in Denver, down in Wash Park, nice guy, that he figured out how to integrate AI to take a CT angiogram, which is basically you put dye in your arm and shoots through your heart, and it analyzes every little vessel, left anterior descending in the right corner, etc. It fillets them out into a straight line, and then to show you segmentally where you've got plaque along that artery, how much narrowing you have. Is it soft plaque, which means you can really break it down and clear it out, or is it hard plaque calcified, which is kind of stuck there? And do you have a significant narrowing that needs an actual catheterization and a stent? So you can actually prevent a heart attack with this rather than reactively run to the cath lab and have to get a stent and lose half your heart. And that's unfortunately what's happening a lot of times. I mean, the first time I became aware of this is when President Clinton had a heart attack and he'd had a treadmill a week prior, okay? Here you are, President of the United States, getting the classic Walter Reed treadmill instead of a heart scan, which was available at the time. He could have prevented a heart attack, and they would have seen that, gone straight to stent, and prevented the myocardial damage. So it still happens, unfortunately. A lot of people are still doing the old school, but I would strongly advise looking at Clearly. And I have no financial interest in these companies. I just love that I can, you know, save lives. It's a good feeling, right? And then the other thing I mentioned was a Gliri test for like pancreatic cancer and all. It's a single tube of blood. Doing that over the age of 50, maybe every few years, particularly if you have a higher family risk of cancer, is a great one to consider. And then genetic testing, we do tons of genetic testing for how well do you detox and clear heavy metals out of your body, how well do you methylate in terms of being able to work the folate pathway, and then how well is your liver and kidney working, et cetera. So checking for these particular genetic tests can be helpful. And then the microbiome test, which we've mentioned a couple times. Balancing hormones, there's more and more, you know, interest in this over the last decade. I've been doing it for 30 years now, and when I first started doing it, I used to get a lot of pushback from gynecologists who didn't even know about bioidentical hormones, and other physicians thinking I was crazy doing it. Now it's like the big trendy thing 30 years later. We do everything from hormone pellets to hormone cream to patches to injectable, and we don't push one or another. It's just whatever fits the best type of care for the patient in terms of the delivery, in terms of the results they're looking for. But hormones are really cool because they'll help you maintain your muscle mass. What is the number one killer as we get older, right? Besides losing our brains, it's becoming frail and tripping and falling and breaking a hip and then developing hospital-acquired pneumonia while you're in the hospital and somebody's hacking on you, or you get an infection and die related to that. So if you can maintain your muscle mass with more T while also doing more resistance work for both men and women, you're more likely to live longer. Estrogen has been shown to really reduce your risk for Alzheimer's in a huge way, like 30% for women. Now guys, we may not want to do it, but you know, for gals, I think it's, when you look at the benefits of brain protection, cardiovascular protection, etc., it seems to override the minimal risk to the breast, which when the Women's Health Initiative was reanalyzed, it was thought to be non-significant, less than 1% in terms of the use of hormones. And bioidenticals were, by the way, found to be less harmful than the synthetic ones that were always recommended by obstetrician gynecology, unfortunately. So going the natural, when we say bioidentical, we mean the estrogen is identical to what you produce and it's not coming from horse urine. The same thing with testosterone and progesterone, it's exactly the same molecules you produce. And then for guys, oh yeah, I wanted to mention, for guys, this is crazy. I see more and more young guys are coming in their 30s with low T. And the only way I can explain that is stress and plastics. In stress, the cortisol creates the feedback loop, which shuts down luteinizing hormone and reduces testicular levels of testosterone. And then the BPA mimics estrogen, which then has an inhibitory effect on testosterone. So these poor guys have got a T level of an 80-year-old, and I'm having to help bring it up, either by stimulating their brains through Clomid, which we often use in women for ovulation, or by even starting them on injectable or topical gels. So something to watch out for. And again, it's, you know, a lot of environmental toxins that could be in the water that are contributing to hormone imbalances for both men and women. And I think it could even be contributing a lot to our obesity crisis, because it's creating toxins in the body, which creates inflammation, which creates fat storage as well. Number 6, peptide therapy. This is an amazing therapy. I've always been an advocate of this. I was doing GHRH, growth hormone releasing hormone, way back in like 2003. Really didn't become hip until about 5 years ago. And now I'm getting newsletters from even skincare facilities that, you know, just do a little bit of Botox and wanted to do peptides. So dentists, you know, med spas are doing it. Do I think it's a good idea? No, because you really need to know the patient. You don't want to be giving peptides to somebody that might have a cancer, for example. And you really need to be monitoring other biomarkers while you're doing this. So if they have a physician who's overseeing one of those clinics and they have a knowledge of being able to look at comprehensive labs and the other interactions, then I think it's okay if they're doing peptides, but otherwise it really needs to be with a regenerative medicine clinic that can monitor your cardiovascular health, your other hormone health, etc. So my favorite peptides are things like the GLP-1s, which everybody knows, we mentioned. They can help the average person lose 10 to 15 pounds in about 3 months. There's a new one coming on board called retatrutide, which is in phase 3 trials, will probably be available in 6 months, I hope. And it's going to be another 10% effective, so you could lose 20% of your weight in 3 months. And it's hitting 3 different receptors instead of 1. That's going to be a rock star. What I'm hopeful is, instead of having to do a weekly injection, people might be able to do a once a month injection, which would be cool. So we're going to keep an eye out on that. Currently, our preferred cocktail is tirzepatide, because it offers the greatest benefit for weight loss available for the best bang for your buck with minimal side effects. And we've been using it. How long have we been using tirzepatide for, Julie? 3 years now? Yeah, quite a while. About as long as it's really been available. BPC 157, body protection compound. A lot of biohackers will use it for tendon repair, postoperative regeneration, after plastic surgery, but it can also be used just for general health and wellness, because it improves microvascular blood flow to the brain, to the heart, to the kidneys. So somebody's got a little low renal output, high creatinine, we can improve renal function doing this one. And it's pretty reasonably priced, but you have to inject this one ideally, you know, at least 5 nights a week to get benefits from it. And then the Tesamrel and the C, ipamorelin are two of the growth hormone releasing hormone agonists, which will go up to your brain and they'll hit your pituitary gland and they'll say, hey brain, you're not producing enough growth hormone, you get a little old there, let's crank out a bit more, which helps with cellular regeneration, tissue repair, improve metabolism, etc. So it's an amazing one. Now there's probably 5 or 6 other ones that we can do, but these are the two that give you the most bang for your buck as well. And then I'm a big believer in IV therapy because you got much better bioavailability. Do I take a lot of oral stuff? Yeah, I take about 15 supplements a day. I'm not like Brian Johnson who takes 150, so I'm 10 times less, but I take a decent amount of oral. But you know, if I'm feeling a little cruddy after a cold, or if I've just been, or I just wanted to do a detox, I'll do some IV vitamin C, some glutathione. I might want to do some vitamin B pushes with our poly-NDA, and then my favorite is the NAD IV because it'll really power up my mitochondria. So there's some amazing things that we can do with the IV therapies and get it into the cells much quicker than we can orally. Takes a little more time, but you know, if you make the time and you're really wanting to make a rapid change, the IV therapies are amazing. And psychedelic medicine has been a passion of mine because I've really noticed how over my 30 years of practice, antidepressants really don't work very well. They're about 30% efficacy. We've shown that on a million trials, and you guys want to double check me on that, you can Google that stuff, right? That's no better than placebo. So when we give somebody Paxil, for example, we don't really treat the depression. We reduce their care about being depressed, so they don't care about being depressed. It reduces anxiety. It's very good for the anxiety reduction. But if you really want to treat depression, ketamine and the microdosing of psilocybin are 70% or better in efficacy. It's unfortunate that these are not legal, while alcohol is totally legal, and we have an opportunity, to treat depression so well. I think Colorado is the most progressive state on this particular subject, and it's great to see so many patients coming to me and saying, hey, I want to microdose. How many milligrams do I do? Is it okay to take it with this medication? What are the side effects going to be? How do I grow it on my own? That's our next workshop, right? But anyway, short answer is I'm excited to see the growth of psychedelic medicine in Colorado. We had the second annual psychedelic medicine conference with MAPS downtown with over 10,000 people attend this summer. There is a center just down the street here, is number 2 that opened up that will do psychedelic journeys for depression and spiritual awakening. Kind of expensive, but it's nice to see this coming up. And if anybody's interested, at the end I've got a fun book, Psychedelics for Brain Health. It talks about how not only does it treat depression, but it can help stimulate brain-derived neurotropic factor. What's BDNF? In short, is miracle growth for the brain. As we age, our brains atrophy, but there's ways that we can nurture our brain and stimulate the growth of the dendrites, which are the branches and the trees of the neurons. And they've shown on electron microscopy that you can absolutely do that with psilocybin and other psychedelics. So if you want to keep your brain more youthful, you add in things like the psilocybin combined with some of the peptides, combined with exercise and diet and lifestyle and mindfulness, and you've got a cocktail for a healthy brain until you're 120, right? But if you go the usual standard American way, you're kind of effed, to be honest. So that's my crazy book, if you guys want to check that out. And then, in summary again, just be smart and stay healthy. Keep yourself up to date. Stay informed. By coming to this tonight, you guys are getting some information. You know, it's not a ton of information, but you can always take what I've told you. You can go on ChatGPT and vet stuff, learn a little bit more. You go to Peter Attia's Drive. I love his stuff. He's got some great stuff, but not a whole lot of information on some of the things that I do, particularly done a deep dive on hormones. Do your best in terms of nutrition and exercise, but don't beat yourself up. I think all of us are going to be more in that 80-20 realm. You know, I'm not perfect all the time, but if we can be good most of the time, I think it makes a difference. consider vaccines. I'm not an anti-vaxxer, but I'm not a vaccine pusher. And I think, you know, when you are seeing a threat such as measles on the rise right now, and if you haven't gotten your measles vaccine, you might actually want to get it this year. The same thing with pertussis, it's on the rise in a big way. And then for COVID, if there's a really lethal variant that comes out, it might be worth getting a booster. But if you're a healthy person, you've had COVID a few times, you've had a couple of vaccines, you probably don't need to get it this year. The flu vaccine, I get asked about that all the time. They do a shitty job matching the vaccine to the variants that are out there, and less than 50% of the time they actually nail it. So I'm a little reluctant to do it unless I see that it's a good match, and if I see, based upon the reports from the CDC or Bugwatch Children's Hospital here in Colorado, that it's on the rise, then I might go get the shot. So it's all a risk analysis before I do the flu shot. I do it before most people because I'm a physician and I get coughed on a lot. And then, yeah, partner with medical practices like ours or anybody that really prioritizes wellness care, prevention, functional and regenerative medicine. I've worked in traditional reactive sick care models, University Hospital, Kaiser Hospital, been there, done that. And they provide great care, but they're not gonna be looking at clearly heart scans. They're not gonna even know what a peptide is. They're sure the heck not gonna know what BDNF is. They're not gonna talk about psychedelic medicine. They're not gonna offer hormone therapy beyond maybe an estrogen patch and the very basics. So if you really wanna take it 2 or 3 levels above the traditional, you have to seek out a functional medicine practice. And then, just in summary, what we do at our place, you know, we've got some cool programs. Our wellness program, Advanced Wellness, which is our great annual program, very reasonably priced. I mean, I know practices in town, a lot of people bitch about our price, but it's actually about half of what everybody else is. There's one down the street that's $20,000 a year, and it's basically internal medicine. You can call me when you need me, but they don't do any of the stuff that we do. The other ones are averaging, you know, 10 to 15,000, so we're significantly, you know, a third to half that price. Our peak performance program for people that just want to do peptide therapy, for regenerative medicine, kind of biohacking, is a more reasonable option for patients. And of course, if you have family members that want to join, they get a nice big discount. I think it's 15% or 10% or something. We have IV therapies that are more medical grade. They're not going to be, you know, like a Myers cocktail, which is a pretty basic, old school E-complex. We have a poly-MBA. I'll let Julie tell you about IV therapies here in a second. And we know how to combine things and stack things in a much more higher level medical grade than, you know, a med spa would. Our ketamine therapy is unique. Julie and I have been offering that. Instead of just putting somebody in a lazy boy and shooting them in the butt with the thing, we offer, if interested, I mean, we can do that, right? But we have a sound table, so you get sound healing and, you know, much deeper dive with the ketamine therapy compared to a lot of these other practices that are trying to send people out pretty quickly. I do a lot of sexual health therapies for guys and for gals to improve sensitivity and function. And then we also offer individual consultations, so if somebody's like, oh, I just want to see Erika wants or Fred wants to get their thoughts on this or that, that's fine. But if you want to have the true wellness longitudinal work, then that would be one of our advanced wellness program type options. And then talk to us after we're done here, and we can answer any random questions you've got and take it from there. And I think for right now, I just wanted to open it to some fun and interesting questions. There's one there.
So, question on IVs. You all got a few that I'm curious about. Methylene blue IV, PC IV, and high dose vitamin C IV, and then NR. Do you offer any of those?
Julie's right here.
Yeah, we offer all of those.
Okay.
We also offer CBD. Now, NR, we've thought about adding, but NR is a precursor to NAD, so we've always been a believer in NAD. However, I've contemplated the option of doing NR because you don't have the
I've done a lot of
side
both, and NR has been way more effective for me because it's a smaller molecule.
Yeah.
I feel like it gets in and it lasts longer.
Nice.
So,
That's
like,
great to hear.
Like NAD to me, and you don't get the heart racing and stomach issues with the NR.
Yeah.
You can do it quicker. It's a little bit more expensive, but but I felt like, it lasted for me weeks, whereas NAD would be like a couple days.
Yeah, that's great to hear. Everybody has a varied effect. And yeah, we were actually talking about adding NR to our menu as well. So it's good to hear. You're getting great
Yeah,
results.
it's just
Yeah.
I'm sure there's people that have the opposite.
Yeah, exactly. That's awesome. Thank you.
But awesome. And the other thing, I just started doing microdosing Metabred 2 tried yesterday, and so I love the results so far, but I've heard great things about it, so yeah, that
Oh, good.
that's pretty exciting.
Yeah.
We do a lot of microdosing of the GLP-1s. I do it myself. I don't get any weight loss from it. I probably use a little bit. But the cool thing about microdosing is it can reduce the inflammatory markers and be a good biohack as well.
That's what that
So
is.
smart you're doing that. So for people that have a healthy weight and they just want a biohack with low-dose GLP-1, semaglutide, tirzepatide, retatrutide in the future, we can do that for you. Awesome. Yeah.
I have a question. Are you a psych NP?
I'm a family nurse practitioner with a
Okay.
psych background. I work
So you could oversee patients coming off,
Yeah.
SSRIs or something?
Absolutely.
Because my clinic's right there and sometimes I need someone to have oversight.
Yeah,
and
let's
coming
talk, 'cause
off
the other thing we didn't
medications.
really mention is with our advanced wellness program, so Fred and I are both board certified family medicine. So we also, in our membership for the advanced wellness, we do primary care, so you could come in for some PAP and some ketamine. I mean, just
In that order.
Get the
Or
Or Botox and ketamine.
Yeah, 100%. So I help people come off, and then if they're looking for a holistic, 'cause I do love holistic